Repealing and replacing Obamacare was one of Donald Trump's signature campaign promises, but the reality of the pledge is not so simple. Larry Kudlow, the Trump campaign's senior economic advisor, described one possible approach on our air yesterday. Let's take a listen.
I think the issue on Obamacare is you've just got to get rid of the mandates because the insurance costs are too high. I think you have to make the exchanges work. You're going to have to figure some way to help the insurance companies get out of this. Now, the House Republicans do not want to bail out the insurance companies. I think they're right, but they're going to have to figure out some way to get them through this transition.
Joining me now is Forbes opinion editor Avik Roy. He is the president of the Foundation for Research on Equal Opportunity, also a former advisor to the Romney 2012 campaign on health care. Avik, it's nice to have you back to the broadcast. Thanks for joining me.
Hey, Alex, how are you?
I'm great, thanks. I hope you are too. Let's get to break this down right now. Can the Affordable Care Act really survive without the mandates?
Yeah, absolutely. So I wrote a piece for Forbes about this morning, explaining how Donald Trump is actually getting a bad rap on some of these pledges that he's been making about certain features of Obamacare that he's not opposed to, like pre-existing conditions. Throughout the campaign, for a year and a half, he's talked about that. He's pledged, one, that he wants to repeal and replace Obamacare. Two, he's pledged to cover everybody. He supports universal coverage. And three, he wants health insurance to be less expensive. With the right kind of legislation, you can accomplish all of those goals in a Trump presidency.
So what kind of help is Kudlow referencing there when he says there needs to be a way to help the insurance companies get out of this?
Well, I think the way you do it, the way I would do it if I were Paul Ryan or Mitch McConnell would be you can pass a reconciliation bill with 51 votes in the Senate that would partially repeal the funding streams of the ACA, but that repeal wouldn't go into effect for 2 years. And in that 2-year period, from 2017 to 2019, you then fashion the replacement plan that achieves these other goals that I've talked about, covering more people in the ACA and reducing the cost of insurance for the people who are struggling to afford it today.
Okay, let's talk about the president-elect said when he told the Wall Street Journal, quote, either Obamacare is going to be amended, repealed, or replaced, end quote. Well, yeah, those are the only three options, basically. And that signals a potential walk back from the full repeal that he called for during the campaign. But there is a shift in tone. I mean, you're talking about things that you think got lost in translation, right? That he did talk about some things he would stay with. But when he talks about repealing Obamacare in its entirety, it's hard to sort of cherry pick what he's really talking about.
Yeah, you know, listen, I mean, I've been, as you know, Alex, I've not been shy to criticize Donald Trump during the campaign where I disagreed with him. But I think on this, he's gotten a bad rap. On his policy pronouncements, he's actually been very consistent in saying that he wants to repeal and replace Obamacare, but he wants to cover more people. I think a lot of people sort of get confused about that. They say, well, if you want to repeal and replace Obamacare, you must not want people to have health insurance. And what Donald Trump has tried to argue, and others, and certainly in the Republican Party and the conservative world, that there are other ways to achieve that goal that don't do it the way Obamacare does it.
Okay, let's get a little bit in the weeds here because I'm curious how soon a Trump administration could begin implementing changes to the Affordable Care Act. I mean, I'm reading in part here, even on day one, he could do things. Could insured individuals see changes to their policies on the first day in office?
No, they couldn't see changes to their policies because the policies are designed this year for enrollment next year and last year for enrollment this year. So all that stuff requires a long lead time. So there wouldn't be any significant disruption for people who are covered today under the ACA. And Congress will make sure that any repeal and replace approach minimizes or zeroes out the disruption in the future because people in Congress understand they don't want people to have that disruption in their health coverage and their health care because that can be costly down the road in terms of the quality of the care they receive and the political mandate they have for better reforms. So there's, again, a very careful way to do this with transitional considerations.
Okay, so very quickly, he couldn't then immediately cancel these cost-sharing reductions, the payments that help the low-income Obamacare enrollees afford their deductibles? Or
yeah, there's some talk. There's some talk in the think tank world about that. I don't think that would be wise. I think you do what's appropriate under the ACA statute. And there are a couple of things that the Obama administration did that were in the minds of many Republicans and conservatives and people in the court system, they were illegal. They went beyond the statute. Maybe you roll those things back. But you're not trying to disrupt coverage and prevent people from having coverage, because I think that would be a mistake. And I don't think that's what Donald Trump wants. I think Donald Trump wants to make sure that everybody has coverage and that the disruption in the system is minimized. But there are different things from a regulation standpoint that he can do to actually make the exchanges work better, because there are regulations that the Obama administration imposed that have made health insurance more expensive and less affordable for the people who need it.
Okay, Avik Roy, thank you very much. I'm sure we'll have you back on to talk about this. Thanks.
Absolutely.